Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today's episode is about something that sounds like bureaucracy, but hits right at the heart of public health: the removal of all 17 members of the ACIP, or the Advisory Committee on Immunization Practices. Stick with me, because this matters more than you think. So what is ACIP? Let's start with the basics. As I said, ACIP stands for the Advisory Committee on Immunization Practices. It's a group of independent, nonpartisan experts, scientists, doctors, and public health professionals appointed to guide the Centers for Disease Control and Prevention, the CDC, on vaccine policy. ACIP does not approve vaccines. That's the job of the FDA. What ACIP does is determine how vaccines should be used, who should get them, when they should get them, how many doses, and which groups are at the highest risk. Their recommendations shape the U.S. immunization schedule, and they matter for real-world access. If ACIP recommends a vaccine, it's covered by most insurance plans and by programs like Vaccines for Children. So when ACIP speaks, it doesn't just influence policy, it determines what's available at your local pharmacy, pediatrician's office, or community clinic. So what just happened? Well, here's the headline. This week, the U.S. Secretary of Health and Human Services, Robert F. Kennedy, removed all 17 members of ACIP. He said it was to, quote, reestablish public confidence in vaccine science, and that ACIP had become a, quote, rubber stamp for industry. He was referring to the pharmaceutical industry. But let's be clear, these were not random bureaucrats. They were some of the leading immunization experts in the world, many of them appointed across multiple presidential administrations. To dismiss them wholesale without transparency, process, or even any evidence of misconduct is not a reform. That is a purge. And the consequences could be devastating, especially for immunocompromised patients. Why is this bad for patients? Well, if you're a chronically ill patient, immunocompromised, or if you have children, you are the one with something to lose. Here's why. First, the loss of expertise. Replacing respected scientists with politically vetted individuals undermines trust and could lead to flawed or rushed recommendations. Increased confusion. When science becomes politicized, guidance gets murky. That means more uncertainty for providers, more misinformation for patients, and fewer people protected from preventable diseases. Coverage risks. If ACIP stops functioning as a legitimate expert body, insurance coverage could become inconsistent, and programs like Vaccines for Children could be disrupted. Finally, a chilling effect. What scientist or public health expert would want to serve in public health if they can be dismissed from their job for doing it honestly? And I haven't even addressed who RFK might replace these experts with. It's speculation, but an educated speculation, that they may share the same anti-vaccine bias that RFK holds himself. But this isn't just about vaccines. It's about how we make decisions that affect the health of every community in this country. So what can you do? Well, here's the good news. Patients are not powerless. Contact your representatives. Ask your member of Congress or U.S. senators to speak out against political interference in ACIP and vaccine policy. The science must stay independent. In Louisiana, it is especially important to reach out to Senator Bill Cassidy. He is the chair of the Senate Help Committee, which oversees health. He is also a doctor and has promised to employ vigorous oversight should HHS stray from its mission. Talk to your providers. Let your doctor, pharmacist, or nurse practitioner know you're concerned, and ask how they're staying informed. They may not even be aware of what's happened. 3. Stay engaged. Follow GHLF and local trusted public health authorities for updates. We'll be keeping a close eye on who is appointed to replace these ACIP members and what it means for you. 4. Use your voice, whether it's on social media, in a letter to the editor, or at a school board meeting. Remind your community that vaccines save lives and patients deserve evidence-based guidance, not politics. And most important, ACIP is scheduled to have their next meeting June 25th through 27th. While it is unclear who the members of ACIP will be then, you can submit comments online for the committee at regulations.gov. We will leave the exact URL in the show notes. Also, GHLF will be submitting our own comments, and we will post a link to these comments for everyone to read as well. So what happened this week may feel a little bit like inside baseball, but don't tune it out. When we remove the experts, we remove the guardrails that protect patients. We'll be watching and we'll be speaking up. And keep listening to the Health Advocates and all of our podcasts at ghlf.org/listen. We will continue to keep you informed. Well, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.